Hello, I am Jeanette, in the Nursing 450 class. My group did their presentation on the city of Jefferson Town, which is in Louisville, Kentucky. We're in Jefferson County, Kentucky, but it's one of the small cities that make up Louisville, Kentucky. Jefferson Town is nicknamed J-Town. And it is known, or the city of Louisville is known for the Kentucky Derby. We also have the Muhammad Ali Center. It's a museum that showcases not only Muhammad Ali, but also other boxing greats. Really nice museum. If you've never been there, it's something to see. We're also known for the Yum Center, which is our basketball hub. It's where our University of Louisville basketball team plays basketball. And we're also known for the 2013 NCAA champs, University of Louisville. We're also known for our Papa John Stadium, which is where our U of L football players play their home games. The population of Jeffersontown, Kentucky is almost 27,000, and which is a 1.1 increase from the 2000 census to the 2010 census. It's predominantly white. 78% of the residents there are white. 11.2% are black, and then 6.2% are Hispanics. As far as the male to female ratio, there is a total of 52% female and then 48% males. Most of the livable structures in Jeffersontown, Kentucky are single-family homes with a median family income of $63,000. The unemployment rate in Jeffersontown is 6.6%. Which is pretty good compared to the rest of Kentucky. Kentucky, which is 6.6%. The Kentucky, the United States unemployment rate, I believe, was 5.8, almost 6%. So it's not too bad. The biggest employers for the area of Jeffersontown, Kentucky is Ford. Ford has two plants. They have the Louisville Assembly Plant and then the Kentucky Truck Plant. And they employ 4,750 employees. Another big employer here in the Louisville, Kentucky area is Humana Inc., which collectively is insurance and hospitals. They employ 28,000 employees here in the Louisville area. And then Yum Brands. Yum Brand is a collection of fast food chains such as Papa John's, Kentucky Fried Chicken, Taco Bell. They employ 1,400 employees at their corporate branch. As far as morbidity is in Kentucky, the highest morbidity in the city of Louisville or Jefferson County, it was 16.2%, and that was for infectious disease. And then for the state, it was 8.0%. And the reason they give for this, for it being so high in the city of Louisville compared to the state of Kentucky, is because the city of Louisville is 99% urban, whereas the state of Kentucky is more rural. But there are more resources available for persons who have infectious diseases such as HIV, AIDS, hepatitis C. There's more resources within the city of Louisville. the one resource that I am familiar with, just because I am a behavior health nurse, and we tend to run into persons who have infectious diseases because of their risky choices with drugs, um, is the Wings Clinic. It was designed it was designed to deal specifically with persons who have infectious diseases. What we chose to do, or what I chose to do, my vulnerable population paper on was teen moms, or as a vulnerable population, and that's because the birth rate for persons ages 15 through 19 in 2012 for Kentucky was 41.5%, compared to the U.S. Rate, which is 29.4%, making us the seventh highest teen birth rate amongst the 50 plus United States. In the United States, I don't know why I put that way. In Kentucky, 82% of the persons given birth between the ages of 15 to 19, 82% were white, 13% black, and 5% Hispanic. And which this breakdown is different from the U.S. as a whole, as far as the race of the mother, and that's because African Americans and Hispanics have a disproportionately high rate of teen pregnancy compared to whites in the United States. So as you can see from the figures that I gave you earlier, which is 82% white, it is a tad bit different, but Louisville, like I said again, is predominantly white. But the number of teen births has gone down 40% since 2010. The teen birth rate in 2010 for the state of Kentucky was 62%. And if you'll remember, I told you that the rate now is 41%. So that is a huge decrease from just a matter of 2 years. The teen abortion rate in 2010 for Kentucky was 6%, and then in the U.S. the teen abortion rate was 15%. And they don't give you the figures from earlier times, but they say that's a 73% decrease in the teen abortion rate for the state of Kentucky. One of the things that I found was lacking within my community of Jefferson Town was the resources for these teen moms. In the city at large, the city of Louisville, Kentucky, there are some resources, but they're still lacking compared to other cities. With the same population. There were a few programs that I did find that were available to teen moms. One was a WIC program, which stands. WIC is a program designed to help teen moms with health care, as well as food items for their infants. The only stipulation is, well, there are several stipulations. They have to meet the income requirement, and I believe the highest for a family of 5, they couldn't make over $40,000. But then also they had to have children under the age of 5 years old. And then there is the HANDS program. It's a program designed for new moms. Persons in this program are referred to the program by their physician, or a hospital, or social services, or they can self-refer themselves to the program. And what happens is a community health nurse goes to their home. She does an assessment, allows them to ask questions, and then she does teaching on how to take care of your child. She also is a resource hub for any financial monies that the mom may be entitled to, as well as child care help, and also also help with food and clothing and other things that may be available to the mom to help as far as the resource is concerned. One of the things that I found very interesting when I was doing my vulnerable population paper was that teen moms, the reason why we want to help teen moms is because the long range effect, not only for them, but for their children. Children of teen moms, females of teen moms, tend to also have infants, also are themselves are teen moms. And the males of teen moms are usually incarcerated by the age of 15. So to me, the figures when I was reading my paper were staggering as far as some of the reasons to help, but then also the graduation rate. 50% of teen moms will drop out of school, as opposed to the 90% that graduate from high school that don't have children. So we can see the long-range financial and social economic effects that being a teen mother can have on themselves, again, and their infants. It also talks about the support. Teen moms tend to, if they don't have the support that they need financially as well as emotionally, they tend to employ bad parenting techniques, multi-generational type situations where the grandmother is also in the home and grandfather tends to be less stressful for teen moms. So you'll see websites out there where the president has gotten involved in this initiative. It's called the Teen Pregnancy Prevention Initiative. Has gotten involved in the programs, but the websites are geared toward teens, but also geared toward mothers of teen moms or fathers of parents of teen moms to help them see what type of supports they need to provide for these moms, but also the support as far as teaching prevention, because many teen moms also have their second baby in their teens. So if we can stop it before it happens, it has better outcomes for the teen. There's another website that I thought was good before I end, and it is by the United States Department of Health and Human Services, and it's a really nice website. It's the name of the website is Office of Adolescent Health. It was developed to prevent teen pregnancy. And what they have on that website are evidence-based programs that communities can take, that tells them how to use it and what age groups is appropriate and also in what settings is appropriate. But these programs are evidence-based, and they focus on things like contraceptives, sex education, risky behaviors, making smart choices, as well as teaching self-esteem, all those things that that helps community develop these things to prevent teen pregnancies. I hope that this information was informative, and it was nice meeting you. Thanks.